Good morning to all. Today we are going to discuss a topic of lower limb, that is nothing but arches of the foot. I am Dr. Arun Prasad. I am an assistant professor of anatomy. I will directly move on to the topic. Okay. Before going to the topic arches of foot, now the foot as such, what is this diagram? This is nothing but a diagram showing the schematic diagram showing the bones of the foot. The bones of the foot is divided into a forefoot, a midfoot, and a hindfoot. Okay. So this is the anterior part of the foot, where we have the metatarsals and the phalanges, that is the forefoot, and we have the cuboid bone, navicular bone, three cuneiforms, which forms the midfoot. And this bone, what is this part? This is nothing but the calcaneum and the talus that forms the hind. So functionally, the foot is divided into a forefoot, a midfoot, and a hindfoot. Okay. So what are the weight bearing areas of the sole? Why we need to know that? Because when we are standing on the ground, we have some weight bearing areas. Which are the weight bearing areas? And this picture show you the weight bearing areas. Okay. So this is nothing but here we have the proximal to the great toe, which we have the sesamoid bone of the first metatarsal, and we have the heads of second, fourth, second, third, fourth, and fifth metatarsals. And here we have the tuberosity of the calcaneus. These are the main weight-bearing areas of the sole. Okay. Now, when we stand on the ground, our weight is transmitted like this. So first it reaches the postero-inferior tuberosity of the calcaneum. From there, it is transferred to the head of the fifth metatarsal. It is also transmitted to the head of the first metatarsal. Okay. You can see it is transmitted in an arch-like fashion. So this is nothing but the arches of foot. What are the components of the arches of foot? You will see in the coming slides. Okay. So this is the weight transmission which happens like an arch. And also there is a transmission you can see that happens between the first metatarsal head and the fifth metatarsal head. Okay. Now, to understand arches of foot, we see a metaphor that is nothing but the stone bridge. Why we need to know the stone bridge? Because they appear to have the similar pattern. Okay. So what is this? This is nothing but a stone bridge. What is this part of the stone bridge? Okay. So if here we have a schematic diagram representing the same stone bridge, especially the arch. This arch is alone explained here. And we need to know four terms here. Okay. First, what is a keystone? Okay. You can see in this picture, this stone is called the keystone. This is the main stone which keeps the arch in its position. Okay. This is called the keystone. Then one more term called tie beam. Tie beam is not there in this bridge, but if you tie from this end to this end by means of a rope or a string, that is called the tie beam. Okay. From this end to this beam, the arch is tied and held together. That is called a tie beam. Okay. Then one more new term called intersegmental ties. What are these intersegmental ties? If we staple each stone by means of a stapler or by means of a metal piece, that is called intersegmental ties. We take each of them as individual segments. Okay, this is called intersegmental ties. That is what is shown here. This is called intersegmental ties. Then a last term, what is a sling? Now, if you imagine that we are keeping the sling or keeping a rope and holding this keystone upwards, that is called a sling, or other is called a suspension bridge. Okay, keystone sling or suspension bridge. So this keystone is held together above and it is tied to a rope like this. That is called a sling. So all these four terms we are going to use in the arches of foot. That is what we should know. Okay. Now, to make it easier, what is a keystone? Again, just to repeat. So we have a stone bridge. Okay. Similar to that, we have a bones here. What is this bone? Anybody? So this is called the calcaneus. Above the calcaneus, we have the talus, and this is the navicular. So this part is the keystone. Keystone is the one which is there on the summit of the arch, which is keeping the arch in its position. Next, what is intersegmental tie? Intersegmental ties are the ties which are present between the individual component of the bone of the arch and keeping it in position. We have some ligaments which appears like intersegmental ties. We'll see in the subsequent slides. What is a pillar? Here in this bridge, if you see here, this, if we take it as anterior and posterior, this bones or these stones will form the anterior pillar. This will form the posterior pillar. Okay. So this part we call it as anterior pillar. This part we call it as posterior. If you take this as front and this as back, this is the anterior pillar and posterior pillar. What is a tie beam? Just to repeat, the end of the bridge or end of the arch is held in position by means of a tied rope. That is nothing but the tie beam. We can see here, we can see an arch-like pattern on the foot, which is held on the lower part by means of a plantar fascia. So here, plantar fascia is acting like a tie beam. What is a sling? Excuse me. So in this part, the keystone is held up together by means of a rope that is called a sling. You can see here there is a peroneus longus muscle which tendon which is keeping this in position. That is called a sling. Okay. Now we'll come to the type of arches. What are the types of arches? So we have a two group of arches. First arch is called the longitudinal arch and other is called transverse arch. In longitudinal arch, we have two more subdivisions that is called medial longitudinal arch, then lateral longitudinal arch. Okay, we can see here this part, this is a bone or bones of the foot. This is one arch. If you are viewing it from the lateral aspect, we are viewing it from the medial side, you can see an arch-like fashion. So this is called a longitudinal arch. If you divide the foot in a longitudinal fashion, you can see an arch that is called longitudinal arch. Next, what is the other arch? Okay. So these are the bones that forms the medial longitudinal arch. This shaded part forms the lateral longitudinal arch. We'll see that in the subsequent slides. So in longitudinal arch, we have a two group. One is a medial longitudinal arch, other is called a lateral longitudinal arch. This shaded bones, can you anyone name what is this bone? This is nothing but the calcaneus, a part of calcaneus, then cuboid bone, fourth metatarsal and fifth metatarsal. These forms the lateral longitudinal arch. The other bones will form the medial longitudinal arch. What are these bones? Again, the calcaneum, talus, navicular, three cuneiforms, and three metatarsal will form medial longitudinal arch. Okay. So we have seen the longitudinal arches of the foot. Again, we are going to see the transverse arch. So where is the transverse arch? Now, if you view the foot from the side or from the front aspect, you can see a small transverse arch here. So this arch is called the transverse arch. So we are viewing it from the side, that is the longitudinal arch. If you view the foot from the front, that is called a transverse arch. Transverse arch is again divided into an anterior transverse arch and a posterior transverse arch. Okay, so we'll go to the first part, that is the medial longitudinal arch. Again, what are the bones that forms? These are the group of bones that forms the medial longitudinal arch. We are viewing that from the side. From which side? This is nothing but the medial side. We are viewing the foot from the medial side. We can see only the first metatarsal. Actually, the second and third are behind that. Okay, we can see the calcaneus. We'll see about the components of this arch. Okay, what I told about the pillar. Pillar is nothing but in an arch, the part which is touching the ground is the pillar. Okay, so what is the bone that is touching this part? This is called the anterior pillar. What are the anterior pillar? The anterior pillar is formed by heads of the first, second, and third metatarsal. Why you are not seeing the other two? Because we are viewing from the side, you can see only the one bone, but actually first, second, and third metatarsal will form the anterior pillar of medial longitudinal arch. What forms the posterior pillar? Only one bone. What is that? Medial half of calcaneum. Medial half of calcaneum will form the posterior pillar. Then, what is a summit or keystone? What I told about the keystone in a stone bridge, in an arch, on the summit, we have a key component of the arch that is called the keystone. What is the summit bone here? Talus. So talus forms the keystone of medial longitudinal arch. Talus bone forms the keystone of medial longitudinal arch. So we have seen the pillar of arch and keystone. Next, we should know the joints which are there in the medial longitudinal arch. What are the joints which are there? Two joints are there. Talocalcaneo-navicular, big name. Okay. In short, we can call it as TCN joint. What is this? So we have talus, we have calcaneus and navicular. This green shaded part is the joint. So this is called what? Talocalcaneus calcaneonavicular joint. This is the TCN joint, which is there in which arch? Medial longitudinal arch. One more joint is there that is called subtalar joint. What do you mean by sub? Anything which is below is called the sub. Okay. So below the talus, okay, this is nothing but the fibula and tibia. Below that, we can see the talus bone. Below the talus, you can see a green shaded area. That is nothing but the subtalar joint. So two joints are there in the medial longitudinal arch, a TCN joint and a subtalar joint. Now we come to the lateral part. I already told you that this shaded bones forms the component of the lateral arch. Okay, so what are the bones? A part of calcaneus, especially the lateral half of calcaneus, and cuboid bone, lateral to metatarsal. Okay, now what is the lateral arch pillars? What are the pillars? You can see here, just seeing the picture. Anatomy is nothing but see the picture and understand the terms. Then everything is easy. What is this? We have the pillars. What I told about the pillar, the one which is touching the ground is the pillar. So what is the one which is touching the ground on the lateral side here? This is the lateral part of calcaneus along with the tubercle. Okay, this forms the posterior pillar. Anterior pillar, what is the bone which is touching here? Leave the phalanges. We are talking only about the arches. What are they? The fourth and fifth metatarsal. They forms the head of the fourth and fifth metatarsal forms the anterior pillar. Okay. What is the summit here? Cuboid bone. Okay. Sorry. So summit is the cuboid bone and joint. There is a mismatch here. What is the joint that is formed here? Calcaneo-cuboid joint. Okay. It is not the superior facet of calcaneum. Actually, the summit is formed by the superior facet of calcaneum, but keystone is the cuboid bone. Okay. What is the joint that is formed here? We have the calcaneo-cuboid joint. Between the calcaneum and cuboid, you can see a joint here. This is called the calcaneo-cuboid joint. That is a joint which is present in which arch? Lateral longitudinal arch. When you compare this medial arch and lateral arch, the lateral arch is at a lower and less mobile than the medial arch. When you keep the foot on the ground, you must have felt that the lateral part of the foot is actually touching the ground. The medial part is actually above the ground. Okay. So lateral arch is at a lower and less mobile than the medial longitudinal arch. Now, you should know some factors for the medial arch. What are the factors? What do you mean factors? So this arch is kept like this. Okay. So this arch should be in its position by means of certain factors. Okay. Other than the main bony components. What are the factors? Bones. Sustentaculum thalli. What is this? Sustentaculum thalli. In a talus bone, we have a projection, like a shelf-like projection that is called sustentaculum thalli, which supports the head of the talus. Okay. Sustentaculum thalli is a part of calcaneum bone. Okay. Which supports the head of the talus. Sustentaculum thalli is not a part of talus. It is a part of calcaneus, which is supporting the talus. You can see this small projection here, which is supporting the talus. That is also helping in the medial longitudinal arch, maintaining that. Okay. Here also you can see, this is the calcaneum bone. You can see shelf-like projection that is called sustentaculum thalli. Above that, what is this bone? This is the talus. Okay. This is also a factor which keeps the medial arch in its position. Because the keystone is talus, it has to be supported. What are the ligaments here? We have a plantar calcaneonavicular ligament, interosseous ligament, interosseous talocalcaneal ligament. There is a C should be there. Okay. In anatomy, you should understand the meaning of the terms. Everything is easy. So some ligaments are there which keeps this arch in position. Okay. Now, plantar calcaneonavicular ligament, which is otherwise called the spring ligament. So here on the plantar side, between the calcaneum and navicular, along with the talus. But talus is not participating. It is between the calcaneum and navicular. So it's called plantar calcaneonavicular ligament. Okay. There are some interosseous ligament also. Interosseous means nothing but between the bones, there are some ligaments. That is called interosseous ligament and interosseous talocalcaneal ligament. Between the talus and calcaneus, you can see here one ligament is there. That is called interosseous talocalcaneal ligaments. All these ligaments keeps the medial arch in its position. Plantar calcaneonavicular ligament. The other name for that is nothing but spring ligament. We have interosseous ligament also and talocalcaneal ligament also. Okay. So these are the factors that keeps the arch in position, especially the ligaments. There are some muscles also which keeps this medial arch in a position. Okay. Again, the same term I told you know what is a tie beam? Tie beam is nothing but a structure which is there connecting the end of the arch and keep that in position. We have seen that in the stone bridge now. Now, what is a tie beam here? Medial plantar aponeurosis. So medial part of plantar aponeurosis. This is what is aponeurosis? It is nothing but a modification of deep fascia of the foot is called aponeurosis, plantar aponeurosis. The medial part of the plantar aponeurosis forms a tie beam along with one more muscle here that is called abductor hallucis. What is hallux? Hallux is the one which is attached to the first toe. Okay, abduction of the first toe, otherwise called the great toe. Medial plantar aponeurosis, medial part of plantar aponeurosis and abductor hallucis would form the tie beam of which arch? Medial longitudinal arch. What is a sling? Any structure which keeps the keystone in its position above, that is called a sling. Okay. What are the structure that is holding the talus here? Tibialis posterior, flexor hallucis longus. You can see here the tendon of tibialis posterior is running like this, as well as the tendon of flexor hallucis longus is both are running above and keep pulling the talus above so that this arch is kept in position. That is called medial longitudinal arch is supported by two structures, a tie beam and a sling by means of this muscle and fascia. Now we are moving on to the lateral arch. What are the factors that is keeping the lateral longitudinal arch in its position? What is the bone here? The keystone is cuboid. Okay. What are the ligaments here? The ligaments are the intersegmentals. What is intersegmental tie? We told you that intersegmental ties are keeping the each part of the segment like a stapler. Okay, which is keeping in its position. That is called intersegmental ties. What is the intersegmental tie here? Short plantar ligament and long plantar ligament. Okay, here you can see here there are two ligaments. So this part is medial arch. We are talking about the lateral arch here, which is held in position by means of intersegmental ties. You can see here one ligament which is attaching this part that is called the short plantar ligament. And from here to here, we have a long plantar ligaments. These are acting like intersegmental ties. Okay. Short plantar ligament supports the calcaneocuboid joint because cuboid bone is here. This is the support of the calcaneocuboid joint. This long plantar ligament, which is supporting on the lower part of the calcaneocuboid joint. Both the supports the long, but what is the difference? It is broad and thick, but here it is long. Both plantar ligaments supports which joint? Calcaneocuboid joint. They are acting like intersegmental ties for lateral arch. Now we are moving on to the muscle. Sorry. We are moving on to the muscles of this lateral arch. What are the muscles? Again, the same thing. What is a tie beam? The tie beam is the one which is attaching the end of the arch. What is attached here? The lateral part of plantar aponeurosis and flexor digitorum brevis and flexor digitae minimi brevis, adductor digitae minimi brevis. This muscle is not seen here. These are present on the lower part, which is acting like a tie beam. So the muscles which are attached to the little toe, along with the lateral part of plantar aponeurosis, act like what? It act like a tie beam. What is a sling? Again, same thing. What is a sling? The sling is the one which keeps the keystone above and keep the arch in its position. What is the sling here? The peroneus longus and peroneus brevis, which is there on the lateral part of the foot or lateral part of the leg. This is the peroneus longus tendon and peroneus brevis. Long muscle is longus, short muscle is brevis. They act like a sling. What is the keystone of the lateral arch? Cuboid bone. So that is held in position by the peroneus longus and peroneus brevis, which act like a sling for the lateral arch. So you can see here in this picture, the peroneus longus pulley. Okay. Okay. So the peroneus longus and peroneus brevis, especially this longus muscle will come to the medial side. So this is acting like a pulley and attached here, attached to the base of the first metatarsal, that is peroneus longus muscle. Now we are moving on to the second part, which is transverse arch. Transverse arch is slightly easier than the easier to study than the longitudinal arches. We have two arches, a anterior transverse arch and a posterior transverse arch. What is anterior transverse arch? This is a complete arch. Okay. On the anterior part, we have a complete arch that is formed between the head of first metatarsal and fifth metatarsal. Do you remember on the first part of the question, weight bearing, I have told you that there is a transmission of weight happening between the head of first metatarsal and the head of fifth metatarsal. That is called a transverse arch. Okay. That is called which arch? Anterior transverse arch, which is a complete arch. From here to here, it is a complete anterior transverse arch. Then what is a posterior transverse arch? You imagine that we are keeping our foot on the ground. We could see some part like this. Okay, especially on the posterior side. So it is an incomplete arch. It can be completed only by the arch on the opposite side. So if we imagine this is the right posterior transverse arch, left posterior transverse arch, it's an incomplete arch. When we keep the foot together, we will get a complete single posterior transverse arch. So it is formed by what bones? The bones of the tarsal bones and the metatarsal on the in a transverse fashion. That is forming the posterior transverse arch. We can see this transverse arch together. We need not study this anterior and posterior separately for the factors. So what are the bones? The tarsal and the metatarsal, which is forming the larger surface, larger dorsal, and the main factor is nothing but the tarsal and the metatarsal bones. They have a larger dorsal surface and a smaller plantar surface. This is the one which keeps the transverse arch in its position. We also have ligaments here, superficial and deep transverse metatarsal ligaments at the head of the metatarsals. They maintain the shallow arch of the metatarsal heads. Okay. So these are the ligaments that helps in the transverse arch. We also have muscles here. What is a muscle here? The thigh beam. What is the muscle in this thigh beam? The peroneus longus muscle and tibialis posterior. You can see in this picture, the peroneus longus will come from the lateral side and go to the first metatarsal. I told you, base of the first metatarsal. Okay, that is peroneus longus. Tibialis posterior will come here. It will attach to most of the, especially on the medial side of the tarsal, medial side of the tarsal bones. They act like thigh beam and held this. What transverse arch can anybody name? What is this? This is the posterior transverse arch. Okay, the posterior transverse arch is held in position by means of this two muscles, tendons of peroneus longus and tibialis posterior. We also have slings here. What is a sling? The peroneus tertius and peroneus brevis act like a sling here. Okay, the peroneus tertius is shown here, which is acting like a sling, and peroneus brevis is shown here, which is also acting like a sling, which keep this keystone of the transverse arch in its position. Anything which is acting from above is called a sling. What are the intersegmental tie? When you remove all the muscles, what you will get? You will get the introsea. So the introsea is acting like a intersegmental ties. Okay. So hope you understood this. What are the functions of the arches of foot? There are multiple functions we can go through. And what is a clinical anatomy? Okay. What is a clinical anatomy? Flat foot is the main common clinical anatomy here. So here we have pes planus. What is pes planus? You must have seen some patients or some people will have a flat foot. They will, if they touch the ground, the foot will be flat. It's one of the most common foot problem. Okay. Why it happens? Because the collapse of the medial large arch. Medial arch is supposed to be here. It get collapsed down because of certain factors. This is called pes planus. Pes means foot. Planus means flat. Flat foot is called pes planus. Okay. It's due to the collapse of the medial longinal arch due to long period of stretching. Overstanding patients or overstanding people might have this. Okay. And also the plantar aponeurosis and the spring ligaments are overstretched. Okay. So the head of talus is pushed down. You'll get this picture that is called flat foot. You can see here a type of gait here. This is called clumsy shuffling gait. Okay. Because of the pes planus, the person is having a shuffling gait. Okay. Because of this, they are liable to trauma. This type of gait is called what? Shuffling gait. It happens with the pes planus because they could not able to. Here, this patient is having on the right side. We have more pes planus. What is the problem with this pes planus? The person will have a liable to the injury to the nerves and vessels because this is touching the ground. The nerves and the vessels of the foot are more liable for injury. Okay. They will also have a pain on the metatarsals. That is called metatarsalgia. Algia means pain. A forefoot pain can happen because the entire metatarsals are touching the ground. They are susceptible to pain. Okay. There is a term called pes cavus. Pes cavus is just an opposite of pes planus. Here we have more arch. Okay. This is called pes cavus. Other is called the high arched foot. Why it happens? Because of the contraction of the transverse tarsal joints. Okay, transverse tarsal joints are get contracture. So they will have a dorsiflexion of MTP joint. MTP is what? Metatarsophalangeal joint, dorsiflexion, and plantar flexion at this interphalangeal joint. So this is the pes cavus. It's also a clinical picture related to the arches of. And one of the most common congenital anomaly of the foot is called club foot. It appears like a club foot. Okay. Okay. Club is nothing but the uh, stick which is played on the polo. Okay. That is called a club. This is called the club foot. It has some variants. Talipus equinus varus, or Talipus equinus, Talipus calcaneus, Talipus varus, Talipus valgus, Talipus equinovarus. Most common is CTEV, congenital Talipus equinovarus. So this deformity is more common, okay, which has a combination of. At last, we have also a term called hallux valgus. Hallux means a great toe. Valgus is the deformity is towards moving towards the lateral side. This is called a hallux valgus. Hammer toe is also related to the arch here. This is appearing like a hammer because it happens between this IP joint, interphalangeal joint. Okay. So we understood from this topic the arches of foots and the clinical anatomy. Happy study. Thank you.